Hello, everyone. My name is Rina Mauricio, and I'm a cardiologist with a special focus on women's cardiovascular health at the University of Texas. One of the things that we wanted to give providers when they read this paper was to know how they can assess and counsel patients prior to ART. So, for that, we have provided our central illustration. We've divided it into three portions. The first is evaluation and counseling prior to assisted reproductive technology. We emphasize there the importance of a multidisciplinary cardio-obstetrics team, which can include MFM, cardiology with an ACHD specialist if appropriate. And then to begin with, to risk stratify the patient for pregnancy according to established risk scores, the modified WHO scores, the HARA score, the Cartwright score. And those individuals who are at prohibitive risk for pregnancy, we can talk about whether or not they would be at prohibitive risk for oocyte retrieval or just pregnancy. And those who are at prohibitive risk for pregnancy, we can then discuss with them utilizing a gestational carrier or other options for building a family. Prior to ART, we also recommend reviewing medications for teratogen and those that may increase bleeding or thrombotic risk. During ART, we have now divided it into oocyte retrieval and embryo transfer. As Dr. Vaught had mentioned, one of the risks with ART is ovarian hyperstimulation syndrome, so we recommend using GnRH antagonist protocols to reduce that risk. And also for patients who are moderate to high risk by the modified WHO criteria, either class 2 to 3 or 3, performing some procedures in a hospital-based setting just so that there's more support for the patient and the care team. And lastly, after we talk about oocyte retrieval and embryo transfer, we then discuss what to do afterwards. For some individuals, they may need to undergo repeat procedures, and if that's the case, either resuming those medications that were being held or discussing the plan to resume them if those repeat procedures are planned. And we briefly discuss management during pregnancy, but again, as has been discussed before, there have been multiple guidelines and statements that have talked about pregnancy, but our focus really with this statement was on assisted reproductive technology.